All right, let's dive in. We're tackling bronchiectasis and cystic fibrosis today. We'll be using this medical textbook chapter to really get a grip on these conditions, especially for, folks dealing with them every day.
It's going to be an interesting one, that's for sure. They are pretty complex, but I think you'll find it fascinating how something seemingly so small in your lungs can have such a big impact on your health.
Okay, so first up, bronchiectasis. You hear about CF a lot, cystic fibrosis, but bronchiectasis, not so much, even though it affects a ton of people, especially women as they get older. It's all about those airways, the bronchi, becoming permanently widened.
And that widening, yeah, not a good sign. It's actual damage we're talking about. Think of it as the framework of your airways, becoming compromised, not just stretched a bit,
Yeah.
but there's real inflammation and destruction going on deep down in the structure of the bronchi.
So it's not just about size then, it's the integrity of the airways. And there are different ways this damage can actually show up, right? Like those cylindrical, varicose, and saccular types of bronchiectasis.
Yeah, exactly. Think of it like I don't know, like you're looking at a tree and you see different kinds of damage on the branches. Cylindrical bronchiectasis, that's like seeing, uniformly dilated branches. While varicose bronchiectasis is more irregular, with bulges and constrictions, kind of like varicose veins, actually. And then there's saccular bronchiectasis, where the bronchi, they balloon out at the ends, forming these little sacs.
So, okay, we've got these different types of damage. But what actually kicks off this whole cascade of inflammation and destruction in the first place? Like, what actually causes bronchiectasis to develop?
A lot of the time, it starts with an infection. Our bodies are constantly fighting these microbial invaders, but sometimes the battle, it leaves a mark, especially in a delicate place like the lungs.
And I'm guessing not all infections are the same when it comes to triggering bronchiectasis.
You got it. While viruses like adenovirus and influenza can definitely be a factor, some bacteria are, particularly good at causing trouble in the lungs. Pseudomonas aeruginosa is a big one.
Pseudomonas aeruginosa, we've heard of that one before. What makes it so much worse than, other bacteria? Is it just more common or is there something else going on?
It's not just about how common it is. Pseudomonas aeruginosa has a few tricks up its sleeve that make it, a pretty tough opponent. It can form these biofilms, which are kind of like slimy fortresses, basically protecting it from antibiotics and the immune system. And it releases these toxins that cause a lot of inflammation and tissue damage.
Sounds like the supervillain of the bacterial world, just wreaking havoc in the
You
lungs.
could say that, yeah. And what makes it even trickier is that it actually thrives in the environment that bronchiectasis creates. So the damaged airways with, pools of mucus, they kind of become a breeding ground for Pseudomonas.
So it's like a vicious cycle, the infection causing damage, making it harder to clear out the infection, and then bam, more infection.
Pretty much, yeah. And it gets even more complicated because infections aren't the only culprit. There are other things that can trigger bronchiectasis too, like inhaling toxic fumes or even aspirating stomach acid.
Okay, those sound pretty scary. Are there ways to protect yourself from those kinds of triggers?
Absolutely. Being aware of environmental hazards, like avoiding those toxic fumes, that's really important. And for people who might be at risk of aspiration, there are precautions that can help, like adjusting sleeping positions or managing, any gastrointestinal issues they might have.
Okay, so avoiding triggers is a good starting point, but are there some people who are just like more susceptible to developing bronchiectasis, even if they, haven't had those extreme triggers?
That's a good question, and the answer is yes. There are underlying conditions that can make someone more likely to develop bronchiectasis. It's like having like a weak spot in your armor.
Like pre-existing conditions that kind of weaken the lungs' defenses.
Exactly. Things like primary immunodeficiencies, where the immune system isn't working properly, or problems with the cilia, those tiny hair-like structures that help sweep stuff out of the airways, they can really increase the risk of bronchiectasis. And of course, there's cystic fibrosis, which we'll be talking more about that soon.
Sounds like there's a lot of pieces to this puzzle, not just one thing, but, a whole mix of factors.
Exactly. And that's why it's so important to consider the individual patient when you're diagnosing and managing bronchiectasis. You can't just have a, one-size-fits-all approach.
Okay, so we've laid the groundwork for understanding bronchiectasis. Now, let's shift gears a bit and jump into the world of cystic fibrosis. Now, for those who might not be as familiar, cystic fibrosis, or CF, is a genetic disorder. It affects a lot of systems in the body. But for us today, we're going to focus on what it does to the lungs.
Right. And to understand that, we need to talk about genes, specifically a gene called CFTR. Think of CFTR as a blueprint for a protein that's really important in regulating the balance of salt and water in our cells. When there are mutations in that blueprint, you know, things start to go wrong.
Like having a recipe with a couple of key ingredients missing or, messed up, and that balance, that salt and water balance, it's super important for our cells to work right.
It is. It's like a delicate ecosystem.
Yeah.
Every cell needs the right amount of salt and water to thrive.
Right.
In CF, that balance gets disrupted, and you get a buildup of this thick, sticky mucus,
Yeah.
especially in the lungs.
And that mucus, it's not just unpleasant, it causes a whole bunch of problems in the lungs.
Very bad. Clogs up the airways, makes it tough to breathe. It also creates a perfect environment for bacteria to grow, so the risk of infections goes way up.
Mm.
And over time, this whole cycle of inflammation and infection can lead to permanent damage in the lungs, kind of similar to what we see in bronchiectasis.
So even though CF and bronchiectasis start differently, they can end up causing similar issues in the lungs.
Exactly. They both share this common pathway of airway obstruction, inflammation, and infection, which leads to those persistent coughs, too much phlegm, and breathing difficulties that a lot of patients experience.
Okay, this is all starting to paint a pretty clear picture of how these conditions develop, but I bet our listeners are wondering what it's actually like to live with these challenges every day.
Yeah, that's a good point. It's one thing to get the biology, but another to actually grasp what it means for people. We'll definitely get into that in the next part.
Okay, sounds good. So we'll take a quick break, and when we come back, we'll explore the symptoms and challenges faced by folks living with bronchiectasis and CF. Stick around. Welcome back. So before the break, we were talking about how CF and bronchiectasis can lead to some serious problems in the lungs. But, for a lot of people, it's hard to picture what that actually means for their day-to-day life.
You're right. It's one thing to understand the science, but it's another to really get what it feels like to live with these conditions all the time.
Okay, so let's try to bridge that gap. Let's talk about symptoms. What are some of the things people with bronchiectasis and CF experience regularly?
Well, one of the most common and persistent symptoms is a cough. And we're not talking about just a little tickle in the throat. It's often a deep, productive cough that, brings up phlegm, sometimes a lot of it.
And that phlegm itself, it can be pretty alarming, right? It's not just your average mucus.
No, definitely not. It can be thick, sticky, and sometimes even discolored, which can be unsettling for patients. And in some cases, there might even be blood in the phlegm, which is, medically we call that hemoptysis.
Okay, that sounds pretty scary. I imagine it can be hard to know if those symptoms are just a bad cold or something, more serious.
That's such an important point. It's really crucial not to, self-diagnose. If you're experiencing a persistent cough, especially with phlegm, you really got to see a doctor to get a proper evaluation. Early diagnosis can make a huge difference when it comes to, managing these conditions.
Okay, so we've got this cough, the phlegm. What else? What are some other ways these conditions can affect someone's life?
Well, apart from the respiratory symptoms, a lot of people experience fatigue. Their bodies are working overtime trying to fight off infections and, clear the airways. So it makes sense that they feel drained.
Yeah, I can imagine. It must be like running a marathon every day just to, breathe.
That's a good way to put it. And over time, these chronic respiratory issues can start to affect other parts of the body as well. Some people develop clubbing of the fingers, where the fingertips become, enlarged and rounded. It's a sign the body's not getting enough oxygen.
Wow, so it's not just about the lung. It's like a systemic issue. It can affect a bunch of organs.
Exactly. And then there's the emotional and social impact, Living with a chronic illness like bronchiectasis or CF, it can be really isolating. It can affect relationships, work, and just overall quality of life.
Yeah, I imagine there's a lot of anxiety and uncertainty that comes with these conditions, especially when you're constantly dealing with, flare-ups and hospitalizations.
Definitely. There's a big psychological burden. And that's why it's so important to have a good support system, whether it's family, friends, or, support groups specifically for people with these conditions. Sharing experiences and just knowing you're not alone can really make a difference.
Okay, so we've painted a pretty stark picture of the challenges, but let's talk solutions. What can people do to manage these conditions and, improve their quality of life?
Well, as you'd expect, treatment approaches are tailored to each person, taking into account the severity of the condition, the underlying cause, and their overall health. but there's some common strategies that can help.
Let's start with the infections. We talked about how bacteria like Pseudomonas can cause so much trouble in the lungs. How do doctors typically, tackle those infections?
Antibiotics are the mainstay of treatment, but it's not just as simple as taking some pills and being done. For people with infrequent exacerbations, they might only need antibiotics during those acute episodes. But for those with more severe disease or persistent infections, long-term antibiotic therapy might be necessary.
So for some people, it's a constant battle against infection.
Yeah, it can feel that way.
Yeah.
And finding the right antibiotic regimen can take some trial and error. Doctors will often start with what we call empiric therapy, basically an educated guess based on the patient's history and symptoms while waiting for culture results to tell us exactly which bacteria is causing the infection.
Okay, that makes sense. You wouldn't want to waste time with an ineffective antibiotic when you're, up against a stubborn infection.
Right. And in the case of Pseudomonas or Euchinosa, which we know can be particularly tough, doctors often have to be more aggressive with treatment, using combinations of antibiotics and longer treatment durations to try to completely get rid of the infection.
All right, so antibiotics are a key part of the strategy, but what about that thick, sticky mucus we talked about earlier? Is there anything that can be done to help clear that out?
Absolutely. That's another major focus of treatment. We use a combination of airway clearance techniques and medications to try to thin and, mobilize the mucus.
Airway clearance techniques, what does that even involve?
It's basically a way to physically help move the mucus out of the lungs. There are different methods. Some involve, special breathing exercises or devices that create vibrations to loosen the mucus. Others, like chest physiotherapy, involve a therapist actually clapping or percussing on the chest to help dislodge the mucus.
So you're like literally helping to shake the mucus loose. That sounds pretty intense.
It can be, but it can be surprisingly effective. And it's often combined with medications that help to thin the mucus, making it easier to cough up. Some of those medications work by breaking down the DNA in the mucus, while others target the salt and water content to make it less sticky.
So you're basically attacking the mucus from all angles, physically breaking it up and chemically changing how thick it is.
Exactly. It's a multi-pronged approach.
Yeah.
And for people with CF, there are even medications that specifically target the underlying defect in the CFTR protein, helping to improve the transport of salt and water and thin the mucus.
So we've got tools to fight infections and tools to clear the airways, but what about the inflammation that's driving so much of the damage in these conditions? Can we do anything about that?
That's where things get a little trickier. We know inflammation plays a key role in both bronchiectasis and CF, but we're still figuring out the best ways to target it effectively and safely.
So it's an area of active research.
For sure. Scientists are working hard to develop new anti-inflammatory therapies that could help slow down the progression of these diseases. There are some promising avenues being explored. For example, inhaled corticosteroids, which are commonly used for asthma, are sometimes used to try and reduce airway inflammation in bronchiectasis and CF, though their effectiveness is still being studied.
Okay, so it sounds like there's still a lot to learn about how to best manage the inflammatory part of these conditions, but it's good to know that researchers are actively looking for new solutions.
It definitely is. And in the meantime, there are things people with these conditions can do to support their overall health and, well-being, even beyond those specific treatments we talked about. Things like regular exercise, good nutrition, and getting enough sleep can make a big difference in managing symptoms and improving, quality of life.
Right. Good reminders that sometimes the simplest things can have the biggest impact on our health.
Absolutely. And it's important to remember that managing these conditions is it's a team effort. It's not just about the medications and treatments. It's about working closely with, healthcare providers, staying informed about your condition, and, and being proactive about your health.
So it's about empowering patients to take control of their own, health journey.
Exactly. It's about giving them the knowledge and tools they need to navigate these complex conditions and, live their lives to the fullest.
Okay, so we've covered a lot in this segment, from, understanding what it's like to live with bronchiectasis and CF day to day to, exploring different treatment approaches that can help. In our final segment, we'll take a closer look at the diagnostic process, the long-term outlook, and some of the newest advances in research. Stay with us.
Feels good.
All right, we're back for the final part of our deep dive into bronchiectasis and cystic fibrosis. We've talked about the causes, how they impact people's lives, and some of the ways they're managed. But before we wrap up, I think it would be good to zero in on diagnosis and what the future holds for people with these conditions.
Yeah, let's do it. Let's start with diagnosis. We've been talking about how both bronchiectasis and CF can cause those nagging coughs, the excess phlegm, even, more serious complications. So how do doctors actually figure out what's going on?
Right, because it seems like those symptoms could easily be mistaken for, just a bad cold or bronchitis or something.
You got it. That's why it's so important not to try and diagnose yourself. See a doctor if you have any concerns at all. Early and accurate diagnosis, that's the key to getting the right treatment and, better outcomes.
Okay, so let's say someone goes to the doctor with these kinds of symptoms. What happens next? What does that diagnostic process actually look like?
Well, it usually starts with a, good old-fashioned medical history and physical exam. The doctor's going to want to know all about your symptoms, how long they've been going on, any past respiratory illnesses, and whether there's any family history of, lung conditions. They'll also listen to your lungs with a stethoscope to hear for any abnormal sounds, like crackles or wheezes. Those can indicate airway problems.
So it's kind of like detective work, gathering clues to put the pieces together.
Exactly.
Yeah.
And based on that initial assessment, they might order some imaging tests to get a clearer look at what's happening inside the lungs.
I imagine they'd probably start with a chest X-ray, right? That's pretty standard for any kind of, breathing problem.
A chest X-ray is definitely a common first step. It can give you a basic overview and might show signs of lung damage or infection. But to really see those airways in detail, a CT scan, specifically a high-resolution CT scan, is that's often the gold standard. It can show those dilated bronchs, which are really the hallmark of bronchiectasis.
So the CT scan, that's what really lets you see those structural changes in the airways.
Exactly. And it can also help rule out, other things that might be causing those respiratory symptoms, like a tumor or something blocking the airway.
Makes sense. Okay, so with those imaging tests, you can often get a pretty clear diagnosis of bronchiectasis. But what about CF? How do you diagnose that? It seems like it'd be more challenging, since it's a genetic disorder.
You're right. Diagnosing CF, it requires a different approach. The gold standard test for CF is something called a sweat test.
A sweat test. That sounds interesting. How does sweating, tell you about someone's genes?
I know it might seem a little strange, but it's actually pretty clever. Remember how we talked about the CFTR gene and how it regulates the salt and water balance? Well, in people with CF, that balance is messed up. And one of the results is that their sweat, it contains higher levels of salt than normal.
So if you find salty sweat, that's a pretty good sign of CF.
It's a very specific test, and it's been the go-to for CF diagnosis for decades. And now it's often combined with genetic testing to confirm the diagnosis and pinpoint the specific CFTR mutation someone has.
Okay, that makes sense. So we've got our diagnostic tools and we've identified these conditions. What's next? What can they expect in the long term?
Well, the outlook, it really depends on, a whole bunch of things. The severity of the condition, the underlying cause, if there is one, how early it's diagnosed, and how well it's managed. It's not a one-size-fits-all answer, unfortunately.
With bronchiectasis, I imagine the outlook is probably a little better if it's caught early and, the underlying cause is addressed.
That's usually the case, yeah. With early diagnosis, proactive treatment, and some lifestyle changes, a lot of people with bronchiectasis can live pretty normal lives. They might have flare-ups now and then, but with good management, they can keep their symptoms under control and have a good quality of life.
That's good to hear. And what about CF? I know it's a more serious and complex condition. What does the long term look like for people with CF?
CF is definitely a tough disease to live with, but the good news is that life expectancy has increased dramatically over the last few decades.
Wow, that's amazing. What are some of the key factors that have led to that improved outlook?
Well, a few things. Early diagnosis and intervention are really crucial. Starting treatment as soon as possible can help slow down the disease and prevent permanent lung damage. We also have much more effective therapies now for managing infections, clearing that mucus, and addressing nutritional deficiencies, which are common with CF. And of course, ongoing research is always leading to new and improved treatments.
Speaking of research, we mentioned some of those cutting-edge therapies being explored earlier, like gene therapy. Are those starting to, actually make a difference for people with CF?
They're really showing a lot of promise.
Yeah.
Gene therapy for CF, it's still early days, but clinical trials are happening, and the initial results are really encouraging. Just imagine being able to, correct the genetic defect that causes CF. It could really revolutionize treatment.
It's incredible to think about the possibilities. So while there are still, challenges, the future for people with CF seems brighter than ever.
Absolutely. And it's not just gene therapy. Research is booming in other areas, too. Scientists are working on new medications that target the root causes of CF, improving airway clearance techniques, and, finding ways to prevent that lung damage from happening in the first place.
So there's a lot to be hopeful for. It sounds like a multifaceted approach, tackling the disease on all these different fronts.
Exactly. It's a combination of research, advances in treatment, and the incredible dedication of healthcare professionals, researchers, and, of course, the patients themselves.
Well, I think we've covered a lot of ground today. We went from the basics of bronchiectasis and CF to all the challenges, the treatments, and that promising future of research.
We saw how these conditions can, really impact people's lives, but we also saw the strength of the human spirit and the power of, scientific progress.
It's been a fascinating deep dive, and I hope our listeners feel empowered to learn more and, to advocate for their own health or the health of loved ones who might be dealing with these conditions.
Knowledge is power. And the more we understand about these complex conditions, the better we'll be at fighting them.
Thanks for joining us on this deep dive into bronchiectasis and cystic fibrosis. We'll be back with another one soon, so be sure to stay tuned.
See you next time.